Okay, cupcakes, here we are back for intro now. And intro this week is CPR. You're going to hear a lot of abbreviations or short terms thrown around. CPR. And I put it on the paper that I gave you all. CPR is cardiopulmonary resuscitation. All right? You're also going to see CAB. Compression, airway, breathing. That's the order in which you do things. You're also going to hear AED. AED is automated external defibrillator, you know, the shock. And FBAO, foreign body airway obstruction. A big fancy way to say you're choking, okay? All right, so on the first page that I gave you all, it goes through the steps, step by step, all right? Adult 2 rescuer and adult 1 rescuer. Nothing changes, all right? Nothing changes whatsoever, except that you don't switch because you're by yourself, all right? Don't try to switch, okay? It's 30 compressions to 2 breaths, and you're going to do that in 1 minute. So if you are familiar with the Bee Gees song, Staying Alive, that's the beat you got to keep to do it, okay? To keep it up. For a child 2 rescuer, it is the same. It is, now normally it would be 30 to 2 if you're by yourself. But when there's a partner with you helping you, it changes to 15 to 2. All right? But the sequence is the same. You get to the scene, you assess it, make sure it's safe for you and anybody else to go in. Then you're going to check the victim. And like I said, if you're 1 rescuer, it's 30 to 2. If you're 2 rescuer, it's 15 to 2. Same thing for the infant. If you're by yourself, it's 30 to 2. If somebody comes to help, it's 15 to 2. So these are the only 2 times it changes for a child or an infant 2 rescuer. Okay? All right, and I have it again on this page, just in case you didn't get it the first time. All right? All right, let's start with the notes. Now, if you notice, there's 25 notes, and guess what? There's 25 questions. And this test, as if it hasn't been before, this test is open book. Now, this is for the American Heart Association. I did not make this test up, but I do grade it. There's 25 questions. You have to get at least an 84, which means you can only miss 4. That's it. Any more than that, you got to retake it, okay? So, we're going to start with the notes. The first step to take to use the AED is to do what? Turn the darn thing on. It's not going to work if you don't turn it on. Now, I do have one in my classroom, and when we all meet at school to do skills check-off, practice and check-off, I'm going to show you this AED and show you how it works, all right? Number 2, after you attach the AED pads to the victim's chest, and the AED detects ventricular fibrillation, or the heart is not really beating, it's just fluttering. The next step is to follow the AED prompts. Ladies, when you turn this thing on, it is all automated. You turn it on. You put the pads on the victim, and they show you exactly where the pads go, all right? Put the pads on the victim, and then the machine starts telling you, all right? Begin CPR. Shock advised. Now, when that happens, when it says shock advised, it's up to one of you doing the compressions to say, okay, I'm clear, you're clear, everybody's clear. You do not want to be touching the victim when the shock is administered, because you will get the shock and you don't need the shock. And you'll end up just like the victim, okay? All right, number 3, to ensure high quality CPR, you're going to hear that term a lot, high quality. CPR is performed. Compressing the chest to a depth of at least 2 inches must be done. Now, we're talking really compressing, okay? You want to use the heel of your hand, and where you want to be, let me show you, let me stand up. Where you want to be on the victim is you find the sternum, which is your breastbone, and you want to put the heel of your hand on the bottom third, well, can't do it like that, on the bottom third of the breastbone. Now, there's a little bitty pointy bone at the end, the xiphoid process. Stay away from that. Don't go that far down, but you want the heel of the hand. You don't want the fingers pressing across because then you're pressing on ribs. You remember we said you fracture a rib, you can also puncture a lung. All right, next one's coming up for me. When using an AED on a hairy chest, the pads may not stick and may fail to deliver a shock. Now, a lot of AED kits do come with razors. If yours doesn't and it is a hairy victim, what you're going to do, if it has more than one set of pads, put one set of pads on and press them on real hard. And the gentleman was going to, well, he's unconscious, but if he were awake, he would know what we go through for waxing, okay? Put the pads on real good, secure them, and then rip them off. And that should take most of the hair off with them. It may even make him wake up. Who knows? Anyway, all right, the ratio. You're going to hear ratio and rate. Ratio is always going to be two numbers. Compression, how many compressions to how many breaths. Rate is going to be one number. How many times per minute do you do whatever it is you're doing, all right? So the ratio for compressions to breaths for one rescuer is 30 compressions to 2 breaths. 30 compressions to 2 breaths. And you're going to do this 5 times in 1 minute. So you better be kind of swift with it, all right? To ensure the rescuer is providing effective breaths when using a bag mask device, and I have that at school too to show you, you've got to observe the chest rise. In other words, even if you're not using a bag mask, if you're just doing plain old mouth to mouth, whenever you give a breath, you want to make sure that the chest is rising. Because if it's not, that means you're not being effective with the breaths that you're giving. You've got to give enough of a breath. Now, you want to give just enough of a breath to see the chest rise. You don't want to hyperinflate the lungs because the lungs can only have so much capacity for air. Once you have exceeded that limit, the air is then going to go into the stomach and it's going to cause what they call gastric distension. The stomach will swell, and when that occurs, the victim's going to vomit. So you may not only have a CPR issue, you may have a foreign body airway obstruction if they choke or aspirate on their own vomit. Whoa. Okay, number 7, to use an AED, automated external defibrillator, on a victim that's submerged in water. Use your common sense. You got to pull them out of the water first and wipe the chest off. You cannot take a snorkel and go in the pool and go underwater and use an AED. No, you can't do that yet, okay? Number 8, you witness a cardiac arrest and 2 additional rescuers arrive to assist. To support a team-based attempt, the 2 rescuers should alternate giving high-quality chest compressions. You giving chest compressions or you giving breaths? Who do you think's going to wear out quicker? Somebody doing this 30 times and doing it 5 times in 1 minute? Or the person that's given 2 breaths? Not that either, I'm not making light of the breath giver, okay, or the person that's giving the breaths, but the person doing chest compressions is going to wear out quicker. So you should alternate. And it's the person doing the chest compressions that calls for a switch. And you try to do it as smoothly as possible. When you switch, if this is your victim and you're on this side and the other person's on this side, you don't change sides. You just move up to the head or move down to the chest, whichever way you're going to go, all right? Okay, number 9, you're going to hear this high quality, and some of these questions are geared toward an office setting, not out in John Q. public setting, okay? 2 rescuers begin high quality CPR, while the 3rd rescuer leaves to get the AED. The 2 rescuers should alternate the compressor role. Now, let me tell you what I skipped. You come upon a victim, okay, out, let's say on the neutral ground. Here we go again. Not the median, but the neutral ground on St. Charles Avenue, all right? And they're out. Out. Are you just going to run up and start breathing in this person's mouth? Or are you going to run up and just start doing compressions on the chest? No. What you're going to do is you're going to, the shoulder, and you're going to shake, and remember, they're out. Hey, are you okay? Now, by now, you've said it loud enough, and maybe you said it twice, that maybe a little crowd has started to happen around you. Hey, are you okay? Are you okay? You go call 911. Don't say 911 because they'll come back and say there's no 11 on the phone. You go call 911. You begin the chest compressions. The reason you do this is because you're shaking the victim to make sure they're unconscious. It may just be a friendly drunk that has passed out on St. Charles Avenue and decided to sleep it off on the neutral ground. So you want to make sure the victim actually needs CPR, okay? Number 10, here's another, this is the office setting. The most appropriate element of team dynamics, meaning each team member knows their boundaries and asks for help before the resuscitation attempt worsens, is you got to know your limitations. In hospitals, they call a code blue. Is a team that comes together. They may be at all different parts of the hospital, but they come together wherever the code blue is. Now, each person knows their job. And if I'm going to be the compressor, I'm certainly not going to try and take over the breathing part, all right? Because that person is better at the breathing. So know your limitations. And again, this question is for a hospital or office setting. Number 11, a victim collapses, is unresponsive with only gasping sounds like that's my gasp, okay? And no pulse. You should begin CPR because gasps is not normal breathing. Number 12, the first course of action for a victim with here comes FBAO. We got a bunch of them in this one. The first course of action for a victim with an FBAO who becomes responsive is to start CPR, beginning with chest compressions. The first course of action for a victim who is choking, all right, now they're choking and they're conscious, but they become unconscious. They become unresponsive. That's when you start the CPR, beginning with chest compressions. Now, I want to tell you something about victims that are choking. You do what's called the tongue-jaw lift. You put your thumb on their tongue and lift the jaw straight up. Not out, but straight out, up, okay? And you can look to see if you can see the foreign body. If you see it, you may do a finger sweep. If you do not see it, do not do a blind finger sweep. I will come find you and I will kick your ass, all right? No blind finger sweeps, because if there is something that the person was choking on, you probably pushed it down further and made it worse. Okay, number 13, defibrillation, that's the AED, is important because it can restore a normal cardiac rhythm. So that's why it's important to get that AED really quickly. You perform chest compressions on a child victim. Now, a child is considered a child from the ages of 1 to 8. I don't know many children that walk around with their birth date tattooed on their chest. So you have to use your judgment. If it appears that they're older than 8, then by all means do the adult CPR, okay? But anyway, to perform chest compressions on a child victim by compressing the chest at least 1/3 of an inch, 1/3 of the depth, again, or at least 2 inches. Everybody's going to be 2 inches with the heel of the hands. Number 5, you and another rescuer come upon an adult victim. It's unresponsive, not breathing, doesn't have a pulse. You should begin performing high-quality CPR. Now, what you're going to do when you've checked it, hey, are you okay? You go call 911. You're going to find the carotid artery or the carotid pulse on the same side of the victim that you're on. Don't reach across. You're going to find that carotid pulse. You're going to feel for it. While you're doing that, you're also going to watch the chest to see whether it rises and falls. This check should take no longer than 10 seconds. If there's no pulse and no breathing, you begin high-quality CPR, okay? Let's see. You and another rescuer begin CPR. After a few cycles, you notice now that the chest compressions are kind of slowing down. You're not doing chest compressions, you're breathing. but the compressions are starting to slow down. You should advise the compressor or the other person, you need to compress at a rate of 100 to 120 per minute. Now, if somebody said that to me in that tone of voice, I would get up and smack them and they would need CPR. So watch what you say and how you say it. Look, this person's doing the best they can do, but they get tired. Maybe they need to switch. So just remind them, look, we got to keep this up at 100 to 120 per minute, okay? All right, 17, to relieve choking in an unresponsive infant. An infant is 0 to 1. You should perform CPR and look in the mouth for the obstructing object. Again, tongue, jaw lift. If you see it, finger sweep. If you don't finger sweep. 18, when performing CPR on an unresponsive choking victim, you should look for the obstructing object every time you open the airway. And you're going to open the airway when you're going to give the breaths, okay? You're going to use head tilt, chin lift. You're going to open the mouth. What I mean by opening the airway, when you're like this, you ever heard somebody say, oh, they're going to swallow their tongue? First of all, that's impossible. The tongue is made of muscles. And you see that? That's a frenulum. That's what keeps your tongue attached. Now, the tongue is made of all muscle. So what may happen if you become unconscious, these muscles become limp. The tongue may drop back a little bit, but it's not going to swallow it. It's connected. So by opening the airway, head tilt, chin lift, you're actually lifting the tongue off of the trachea now. You're opening the airway. So when you do give the breaths will be effective. Otherwise, you're just giving breaths for no reason. All right, let's see. Number 18. We did that one. Number 19. An infant that is responsive but choking. In other words, they're conscious but choking with a severe airway obstruction. To relieve the airway, you should give 5 sets of back slaps and 5 chest thrusts. Here we go. This is the infant. I wish I had a baby doll, but I don't. Turn them over, right between the shoulder blades, way up high, with the heel of the hand. 1, 2, 3, 4, 5. Now, my whole arm is out because I'm supporting the baby's neck and spine. You're going to make a baby sandwich. You're going to do it like this and flip baby over. Now, what you're going to do is the same thing, okay? You're going to do back thrusts, and then you're going to push on the chest at the same spot where you did CPR, okay? So you're going to go 1, 2, 3, 4, 5. Support baby, baby sandwich, flip baby over, chest compressions. 1, 2, 3, 4, 5. And then you can actually look and see if what you've done has helped to relieve anything, okay? All right, number 19, in an infant that is responsive but choking with a severe airway obstruction. To relieve this, you also give 5 sets of back slaps and chest thrusts. 20, allow complete chest recoil. When performing high-quality CPR, assures the heart will adequately refill between compressions. Now, is there any word in that sentence that anybody doesn't understand? So nobody's raised a hand, so everybody understands the meaning of every word in that sentence. Look, I can't help you if I don't know you need help, okay? You don't have to raise your hand if there's a word you don't get. Blink a few times, wave or do something, and I'll go over what the word is. You don't have to even say a word. I'll go over the whole sentence just to make sure. But recoil means that when you press down, you also allow it to come back up. In other words, you don't press down all the way, but only let it come back halfway. You've got to let it completely recoil so it can refill with blood again. What you're literally doing to the person is, the person's on a hard object, the floor. This is not Michael Jackson, they're not in bed. And what you're doing is you're actually squeezing the heart. You're actually doing the whole work of a person's heart, okay? Number 20, allow complete chest recoil when performing we did that one. 21, a victim who is unresponsive with no normal breathing and no pulse, you think they need CPR? I would think so. Yeah, okay. All right, 22. This is another hospital or office setting. The resuscitation team functions smoothly when all team members know their positions, know their functions, and tasks during a resuscitation attempt. Therefore, clear roles and responsibilities are important. These things need to have been decided before the action takes place. You don't wait until you have a code or you see a victim on the ground to decide, oh, do you know how to do this? I don't. You realize the time you're wasting? The guy's going to go, excuse me, I'm dying over here. Okay? So you need to have clear roles defined before the situation arises. Number 23, rapid defibrillation. That's using the machine. Rapid defibrillation is an important link in the adult chain of survival. This is important because it eliminates the abnormal heart rhythm. So you want to look, if the heart's fluttering, it's doing, normally your heart beats 60 to 80 times per minute. But when it's in defib, the heart's doing 300 per minute, but it's not doing this like it normally does. It's fluttering like this. It's not even compressing on its own self to squeeze out blood. So that's why you've got to get the defibrillator to shock them, to get them back into a normal rhythm. 24, during two-person rescue or CPR, here we go again. You notice that the chest compressions is not allowing for complete chest recoil. You should tell the compressor that you noticed a decreased chest recoil. It's how you say it. You know, look, I know you're getting tired, but let the chest completely go down and then let it completely come up. That's recoil. 25, when you and another rescuer are performing high-quality CPR, you should switch about every 2 minutes. And again, it's going to be the person doing the chest compressions that's going to call for the switch because they're going to poop out and get tired quicker than the person giving the breaths. All right, now put a little note at the bottom. In order to become certified in CPR, you must not only check off correctly, you must score no lower than an 84 on the written exam. That means you can only miss 4 questions out of 25, okay? Now, when we get to school, I'm going to show you the AED. We have the mannequins there. You're going to practice actual CPR. Nobody has to breathe in anybody else's mouth. It's all sanitized, and everybody gets their own mouthpiece anyway, all right? So I will show you. You're going to check off on adult, 1 and 2 rescuer, and an infant, 1 and 2 rescuer, okay? That's your check-offs. So when we get to school and I can set up a date for us, I will call you. Again, please don't ignore the phone. I'll call you to tell you when the date and time is, okay? All right, my loves, I will see you all tomorrow, okay? Have a good, blessed afternoon. Bye-bye.